Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system, take actions, and try and make a better system for all of us. We're going to talk about reproductive health and a whole bunch of other topics today. But before we do, let me point out that down below in the YouTube description box is a link to the Healthcare Advocacy newsletter that has all of the backup material and references and studies and actions. Everything I talk about is there. The other thing is that you can, of course, subscribe to the Healthcare Advocacy newsletter and for free and have it delivered to your inbox regularly. So let's talk about reproductive health things. The Texas Medical Board is going to be discussing what qualifies as a medical exception to the state's overlapping abortion bans, following a petition urging the panel to issue clear guidance about cases in which doctors can legally terminate pregnancies. Yeah, sure, we'll see. I hold out no great hope for that action. Anyway, because they're doing that, we need to take action. And here's a real quick one, and you know what? We do this one all the time. But what we have to do is annoy our representatives federally so that they take action and they think their job depends on it. So let's do it. How about Congress passing the Women's Health Protection Act? Restore Roe versus Wade and tell this bunch to shut up. Their contact information is in the resources section below, or on your cell phone. You can send a text message to 50409. And just here's the message: SIGN, SIGN, space PVGQBD, PVGQBD, SIGN PVGQBD. And here's the message you're going to send them. I'm your constituent, and I want you to know the Texas State Medical Board is thinking about what constitutes a medical emergency for an abortion. Women will still die and be faced with unnecessary surgeries because abortions were not available. Some legislators, like Senator Patty Murray, she happens to be my senator, have stood up for women. Listen, you know better, representatives and members of Congress. Pass the Women's Health Protection Act and start saving lives like your job depends on it, because guess what? It does. All right. Here's another one. The title of this is We Support IVF. Liar. A large majority of House Republicans released a budget proposal this past Wednesday endorsing legislation that would threaten to make in vitro fertilization illegal nationwide. Remember, the Alabama Supreme Court had a problem where they said fertilized eggs that were frozen have the same rights as children, and we were all up in arms about it. And Republicans said, oh, no, we favor IVF. Liar, liar, liar. This move is a stunning turnaround after most of the party spent weeks voicing support for IVF following the controversial Alabama Supreme Court ruling that I just mentioned. Okay, Republican care for others. It ain't so. Plans to expand Medicaid coverage in Georgia and Kansas were defeated this past Thursday, that's yesterday, by Republican-led committees in their state legislatures, dashing hopes that eligibility for the safety net program would be extended to more than 500,000 additional low-income Americans. It's in the Associated Press. Okay, let's have something a little bit happier, bring our blood pressure down. Let's talk about a medical milestone. Surgeons in Boston have transplanted a kidney from a genetically engineered pig into an ailing 62-year-old man. It is the first procedure of its kind. If successful, the breakthrough offers hope to hundreds of thousands of Americans whose kidneys have failed. So far, the signs are really promising. This guy's still alive. Here's another happy news story. Safer blood thinners. There is a new class of anticoagulant drugs on the horizon, taking fresh aim at one of cardiology's toughest challenges: how to prevent blood clots that can cause heart attack and stroke without leaving patients at risk for bleeding. This is so important. I'll tell you a story. My daughter works in a hospital, and I mentioned to her that a friend of mine fell and there was bleeding and he was on blood thinners. And she goes, "Oh, Dad, That kills people. I see it in the hospital all the time. Oh my God. Anyway, at least a half a dozen experimental blood thinners are in development that inhibit a protein called factor X1, one of several blood factors that regulate how the body forms clots. This was in the Wall Street Journal, and there's a link to the story there. Let's talk about the federal spending package in healthcare. This week, the government narrowly avoided a shutdown again. And there was money in the package related to healthcare, and let's talk about what's in there. Community health centers and a slew of healthcare programs are going to receive funding increases under a sweeping bipartisan government appropriations bill congressional leaders introduced Thursday. The $1.2 trillion fiscal 2024 spending package covers about 70% of the federal government, from defense to labor, and it includes $117 billion for Health and Human Services Department operations. The measure must be enacted by midnight Friday, that's tonight. It is a little uncertain, I haven't checked how the Senate is doing yet, to prevent a partial government shutdown. But Republicans, my favorite bunch, touted the importance in this package was a clawback of $4.3 billion in unnecessary COVID funding, with cuts potentially falling on activities like genomic sequencing and contact tracing, because if the next pandemic comes around, who the hell wants to be ready for that? Okay, big deep breath. There is an important video. I'm going to recommend you take a look at it. One of the topics that I cover over and over and over again are private equity investments in the healthcare industry. And one of the problems we have is that when someone who's there to make money stands between you and the doctor, you're just a vehicle for making money. And your healthcare suffers, and your doctor suffers, because they don't get to deliver the healthcare you deserve or that they were trained to give you. Anyway, we've discussed private equity buy-ups of hospitals and nursing homes over and over again, and doctor practices. One of the sad events occurs when hospitals decide to become profit centers. Every function is a profit center. If OBGYN is not profitable, out. Cardiology is usually profitable, so they usually keep that. The ER is difficult to be profitable. It is really hard because you have to have a ready-to-go staff to handle pretty much anything 24 hours a day. And, either it gets used or it doesn't get used. And so people would maintain the staff. In order to save money, though, what they've done is they've outsourced the staffing of the emergency rooms to separate companies. And those companies are often funded by private equity. Doctors, nurses, support staff at our levels wind up getting cut in order to make the emergency room profitable. And you know what? Whoever's left there, they're just overworked. I actually have, my wife and I have a friend, it's actually a college friend of my wife's, who managed emergency rooms, and she teaches emergency medicine at USC, and she is just shocked at the sad state at the way ERs are going. It is not good. Anyway, excuse me, I've included a link in the newsletter to a video about how private equity is negatively affecting the emergency room. And if you have time, I recommend you take a look at it. I would point something out to you that if the infrastructure cost of an emergency room were covered, that is, I have the equipment paid for, I have the salaries paid for, then I wouldn't have to worry about outsourcing to save money. All I could do is focus on the health care of the people that come to the emergency room. Well, good news, there's a way to do it. HR 3421, I don't know how many times I'm going to say it, every day. HR 3421, the vastly improved Medicare for All Act, has something called global budgets. And that's exactly what it does. It covers the infrastructure cost in facilities so that you don't have to worry about that stuff. Okay, just put that bee in your bonnet. That's what I've got for you for today. Down below, you can like, share, and subscribe. You can subscribe to Healthcare Advocacy, the newsletter, and get it delivered to your inbox. You can send me a comment. I'd love to hear from you. If you have a topic you'd like researched, I'd be delighted to do it. I do that stuff all the time. You can put it in the comment area, or you can send it to me at healthcareadvocacy1@gmail.com. Have a good evening. Talk to you next week.